The respiratory system and pleurisy. What is the respiratory system and how does it work? The respiratory system consists of all the organs that are involved in breathing, such as the nose, pharynx, larynx, trachea, bronchi, and the lungs. The system works directly with the circulatory system to provide oxygen into the body. Oxygen taken in from the respiratory system moves into the blood vessels that then circulate the oxygen-rich blood into the tissues and cells of the body. The way that these organs work together to deliver oxygen into the body. The organs of the respiratory system work together to move oxygen throughout the body and clean out waste gases such as carbon dioxide. It starts from the mouth that provides entry to the oxygen-rich air into the respiratory tract. The air passes through the nasal cavity where it is filtered to remove all floating particles and dust which get caught up in the nasal hairs or mucous membrane in the nasal cavity. Air is continued to be filtered by the pharynx, larynx, trachea before entering the lungs. The air finally divides into the right and left air tubes known as bronchi, which lead us to the lungs at last. Inside the lungs, the bronchi divide into smaller tubes called bronchioles, which end in tiny air sacs called alveoli, where the exchange between oxygen and carbon dioxide takes place through diffusion. The respiratory system plays a crucial part in the functioning of our body because it is the way that we humans acquire oxygen. Oxygen is a basic requirement for many multicellular organisms because it is used for cellular respiration, which is a reaction between glucose and oxygen to convert it into carbon dioxide and ATP via glycolysis, the Krebs cycle, and the electron transport chain. Now, pleurisy in association with the respiratory system. Pleurisy is a respiratory disease where the tissue separating the lungs from the chest, known as a pleura, becomes inflamed. Also known as pleuritis, this condition can cause sharp chest pains that worsen with breathing. It can also worsen with movement and radiate to your shoulders or your back. The symptoms and effects of this disease vary and fluctuate. Worst case scenarios include fluid or pus buildup between or in the lungs, which can cause them to collapse partially or completely. This blocks oxygen or greatly reduces it to levels that can be left fatal if unattended, and may result in a reduced blood flow. This condition is not a congenital one, meaning that it is not inherited by genetics, and instead is caused by pathogens, which refer to any viral or bacterial component. While it can go away by itself, medication is usually deemed necessary. There are a variety of underlying conditions that can cause pleurisy. These conditions may include viral infections such as the flu or influenza, bacterial infections such as pneumonia, fungal infections, autoimmune disorder, lung cancer near the pleural surface, tuberculosis, rib fracture or trauma, certain inherited diseases such as sickle cell disease, and certain medications. To identify and diagnose it, a doctor may order you to do either a blood test, an imaging of the chest, which may include an X-ray or a CT scan, needle biopsy of the pleural fluid, and bronchoscopy, using a thin tube via the throat to look at the airways. There are quite a few signs and symptoms of this condition that can make it easy to diagnose. A few of the symptoms or effects may include chest pains that worsen when you breathe, cough or sneeze, shortness of breath because you're trying to minimize breathing in and out, and in some cases, coughing or fever. Pleurisy can be categorized into subsets of the disease if additional symptoms are present, such as pleural effusion, atelectasis, and emphysema. In some cases of pleurisy, fluid buildup in the small spaces between the two layers of tissue. This is called pleural effusion. When there is a fair amount of fluid, pleuritic pain lessens or disappears because two layers of pleura are no longer in contact and don't rub together. Atelectasis, a large amount of fluid in the pleural space can cause pressure, compressing your lung to the point that it partially or completely collapses. This makes breathing difficult and might cause coughing. Emphysema. The extra fluid can become infected, resulting in an accumulation of pus called emphysema. And emphysema is often accompanied by a fever. Treatment. Methods for treatment vary depending on causes of the disease. For pneumonia or bacterial infections, antibiotics will be prescribed to manage the infection, whereas viral infections will require little to no interventions and may dissipate on their own. Many treatments depend mainly on the severity of the disease and consist of non-steroidal anti-inflammatory drugs to decrease pain, decrease inflammation, and reduce fevers, analgesics to relieve the pain, narcotics to dull the senses and cause drowsiness to decrease pain, used with caution because these have been known to become addictive, and in some cases of fluid or pus buildup in the lungs, aka pleural effusion, atelectasis, and emphysema, surgical procedures may be required to remove the fluid between the lungs and chest. This is done by inserting a needle to remove all excess air or fluid from the lungs. Pleurisy, in most cases, isn't a life-threatening disease and dissipates on its own. There is a possibility where this may escalate, and in which case stronger medication may be provided or surgical procedures may be recommended. However, in most developed countries, the treatments are in abundance and sufficient in helping your body recover.